All right, well, good afternoon. I hope everyone can hear me, and thank you for joining us for this afternoon's webinar sponsored by the U.S. Council for Athletes' Health, titled COVID-19 Update, What Does the Future Hold for Athletics? My name is Dr. Jim Borchers. I'm the president and co-founder of the U.S. Council for Athletes' Health, and I'm very happy to be joined and going to introduce our speakers here in just a moment. I'm really excited about this webinar today and in talking about our presenters. Again, at USCA here with our group, our mission is to collaborate with every athletic organization to inspire and ensure that athlete health and safety is a priority. And I really am excited today to introduce our moderator for today's session, Dr. Doug Ackerman. Dr. Ackerman is the Executive Director of the Athletic Healthcare Administrators Association and holds extensive knowledge and experience in sports medicine program management spanning the last 20 years. Doug, along with many of his duties, has an expertise and aptitude for instituting new procedures and methodologies into various sports medicine programs across the country. He served on just a number of committees, both nationally and internationally, including the Pac-12 COVID Advisory Medical Task Force, and most recently the NCAA COVID Medical Advisory Task Force. In his other responsibilities, Doug is the Director of Sports Medicine for Samaritan Health Services at Oregon State University, and recently was back and forth with the Oregon State basketball team in and out of the bubble in Indianapolis for their run to the Elite Eight here, their men's basketball team. And so really excited to have Doug here today. And I know that as I introduce Doug, he'll introduce our other guest here today. So Doug, thanks very much for moderating this session today.
Thank you, and I'm glad to have everybody here. This is an interesting time as we're facing COVID, and in a time where I think it's decreasing across the country, yet maybe increasing in some places of the world, and some exciting new things on the horizon. Dr. Schwartzberg, John Schwartzberg, is joining us as an expert consultant panelist. Dr. Schwartzberg and I have spent many countless hours on webinars over the last 6 months, and he has been a tremendous resource. I've learned a tremendous amount from him, and I think you all will learn from him as well on this webinar. Dr. Schwartzberg is a clinical professor emeritus at University of California, Berkeley, in the School of Public Health's Infectious Disease Division. He's a member of our Pac-12 advisory task force as it relates to COVID, and has been very instrumental in helping us guide our policies. He has been a national resource in infectious diseases and has been interviewed and quoted quite extensively across the national media. Not too many times are you not picking up a national syndicated news article about COVID and seeing something from Dr. Schwartzberg, whether it be National Public Radio, PBS, New York Times, Sports Illustrated, among many, many others. And John, thank you very much for joining us today for this discussion.
Thank you, Doug. It's a pleasure to be here, and I've really enjoyed those last many months with you and the advisory group from the Pac-12. I also really appreciated what Dr. Borchers said at the beginning about how stressful this has been on everybody. And particularly, I think, for the attendees at this meeting today, I'd like to second his acknowledgement of how stressful I'm sure this last year has been on them. So look forward to a discussion with you.
Great. So I'm going to go ahead and give you a little introduction here. These are the topics that we're going to be covering. Certainly, if you have questions and answers, please put them into the question and answer box. And we have folks from U.S. Council of Athletes Health ready to answer some of them and or put them up for bigger and broader discussion on this webinar as we go. So the main categories we're going to talk about are in 5 big buckets, and I have some bullet points that on each one of these slides as we go through that we're going to try and cover, but we're going to keep an eye on the time too, and let the conversation be a little bit more free flowing, and so we may not cover every single bullet point. I hope that we touch on most of them, but I think there's some current areas that are really important that I think a lot of people have questions. There's not a day that doesn't go by that I'm not getting an email, a text, or a phone call from somebody that's asking these questions. And I'm sure you all are as well. You know, the athletics healthcare administrator is a position that's been created by the NCAA to be kind of the point person for information transfer across athletic departments back from the NCAA, but also to try and keep your a wide breadth of information of what's going on across the world and what are the standards of practice and standards of care. And COVID has, I think, introduced a whole new world of responsibility to the athletic healthcare administrator. And that's why we created the Athletic Healthcare Administration Association within USCA. And we have a really robust discussion forum that people are posting questions on, and some of these questions that we're going to talk about come from there. So the first main topic is kind of updated information about COVID-19. And you know, within the last week, we've seen numerous news reports and PR statements from the CDC, among others, about that there's some changes going on in terms of the spread of COVID. And on that screen there, you can see what our 7-day moving average is across the United States. And John, I'm going to ask you first is what's going on here in the last couple of weeks? And we start to see that curve climbing up again. And what do we need to be worried about there?
Sure. Well, it's really interesting to look at the graph you have there, but I draw first everyone's attention to March of 2020, just a year ago. And you notice how we had that, at that time, seemed like a very profound surge. But you notice how the numbers didn't come down back to the baseline in May. And yet we opened up things considerably around the country in May and in June. Many of you may remember that picture of Lake of the Ozarks with all the people in the swimming pool on Memorial Day. And then we had that next surge toward the end of July. And notice the same thing happened where it came down, but it never came back down to the baseline. And then we had the horrific surge of December and January. And then we had that remarkable 9 weeks of a decline beginning late in January and extending all the way nearly to the 1st of March. And now you see the same phenomenon again. Notice where the baseline is right now. It's really right at where we were at the peak of our summer surge. So we're having right now as our baseline roughly the same number of cases we had at the peak of our summer surge. And many of you may remember how worried we were at the peak of that summer surge. So while it's been gratifying to see those wonderful 9 weeks, we then saw a plateau for about 3 weeks, and now we're seeing a rise again. And this is really mirroring what we see happening in much of the rest of the world. For example, Europe, especially Western Europe, with the exception of Britain, they're locking down again. India is having a horrific time. Brazil has now taken the opprobrium off of the United States for having the most cases most cases in the world for one country. We're now number 2. So I'm very concerned about these numbers creeping back up again. And, you know, we're seeing the same pattern over and over again. There's a famous quote from Albert Einstein saying that the definition of insanity is to continue to do the same thing over and over and expect a change.
Is you know, the B117 variant is probably the most widespread variant that's out across the country in terms of the United States. There are other variants that are out there, and while I think we need to be aware of them, I don't know that, and from my point of view, it really changes what we need to do in terms of risk mitigation and mask wearing and social distancing, because that quite honestly is the best way for us to try and prevent any spread of disease or of COVID. Is that what you would advise as well, Dr. Schwartzberg?
Absolutely. You know, B117 that you're talking about, Doug, that's what caused such havoc in the United Kingdom over December and January. But the good news with that, there's bad news and good news. The good news with that is that it responds to the immunity we get from our vaccine very well. So if we're vaccinated, we're not going to get B117. The bad news is that it's about 50% more transmissible. Probably within the next 2 weeks, it's going to become the dominant strain here in the United States. So we're going to be contending with a strain that is more transmissible, maybe a little more virulent, that is, maybe can cause more severe disease, but is exquisitely susceptible to the immunity we get from our vaccine.
And certainly that'll have a huge impact on our student athletes and the athletic group as we go. You know, on the screen now was the most recent updated risk level for spread based off of COVID Act Now website from 2 days ago. And I track this almost daily, and it's been tremendous to see it go from the entire country being almost red to being yellow, and now even seeing pockets of green. And I think obviously that's going to be important for all of us to try and keep it into the yellows and or green to have an opportunity to have sports in the summer and in the fall. Dr. Borchers, what about athletes? Are we concerned? Are they more at risk if they get a variant as opposed to a regular COVID illness?